I would like to report an additional 218 cases of COVID-19, bringing the total number of cases in Alberta to 5,573. Of these, 2,359 people have now recovered. Since my last update, we have also confirmed 3 additional deaths in the province. This brings the total number of lives lost to 92. All 3 deaths were in continuing care facilities experiencing outbreaks, which is a reminder of why we need to continue to be vigilant to protect this population. My thoughts and sympathies go to everyone grieving the loss of a loved one today. We should never let these numbers become just another statistic. As of today, there are now 580 COVID-19 cases in outbreaks in continuing care facilities across the province. An outbreak has also been declared by Alberta Health Services at the Amazon Fulfillment Facility in Balzac, where additional measures have been put in place to prevent spread. 5 cases have now been reported at that facility, although it is not yet clear if all 5 are linked with a common exposure. We have just received this confirmation, so it will not be reflected in the outbreak listing on our website today. In addition, 2 positive cases have been identified at Alpha House in Calgary, where a rapid response team is now supporting that location to put outbreak measures in place. At High River's Cargill meatpacking plant, there have now been 921 cases. There have also been 390 confirmed cases among workers at the JBS plant in Brooks. I want to commend the frontline public health professionals and their partners who are responding to all outbreaks across the province. They are working quickly to contain the spread, providing public health guidance to employers and operators, testing anyone who may have been exposed, and supporting those who have become ill. In the last 2 weeks alone, these teams, among other things, have called every household with a Cargill worker, have tested every client who stayed in one of the shelters where a COVID case has been confirmed, have offered large volume testing to residents of Brooks over 3 days earlier this week, and have continued to do the regular daily work of case follow-up and contact tracing that is the backbone of our ability to prevent spread of this virus. Their tireless work is an integral part of our response to this public health emergency, and I want to recognize and celebrate their dedication. The extent of these outbreaks demonstrates not only how easily this virus can spread, but why it's so essential that we uncover the source of transmission so we can find out who is at highest risk of exposure. Today, we are launching another useful tool that can supplement the critical detective work we are conducting in public health. ABTrace Together is a voluntary, secure, mobile contact tracing application to help prevent the spread of COVID-19. You only need to download the app and provide your mobile phone number to register. The app is now available to all Albertans in the Google and Apple app stores. Let me tell you how this app will help us prevent spread. Through the process of contact tracing, public health workers currently identify who may have come into contact with a person infected with COVID-19 by asking questions of the case and relying on their ability to remember everywhere they have been in the past several days and who they were near. These people, their contacts, are then called to find out if they are sick and to make sure that they stay home for 14 days from the last exposure, even if they are feeling well. This is a vital step in preventing further spread of the virus. It is also time-consuming and resource-intensive, relying on each individual's ability to recollect who they may have come in contact with and then follow up with each of those individuals in order to be successful. When a contact tests positive for COVID-19, they become a case, and the contact tracing process is then repeated to identify, test, and isolate their contacts as necessary. Contact tracing, when complemented by aggressive testing, can help us interrupt ongoing transmission and reduce the spread. The faster Alberta Health Services contact tracers can inform exposed people or close contacts, the quicker we will be able to prevent potential outbreaks and identify when Albertans must self-isolate. In addition, these tactics yield valuable data that can help us get a better understanding of how the disease is spread and what underlying factors can contribute to cases of severe disease. Like bringing a camera into focus, these techniques give us a far clearer picture that help us to inform our actions going forward. With respect to gatherings in homes or outside of homes, it is currently allowable that up to 15 people gather as long as 2 meters of distance can be maintained. So at this time, certainly as we're easing cautiously back into more interactions, then the maybe reduced risk to arrange for outdoor gatherings. So if people want to visit family members, again, ideally staying 2 meters apart from those who are not in the same household, then those kinds of gatherings with family or friends can take place again with small groups, so less than 15, making sure to keep that 2 meter distance. And it would be my recommendation to not share food or drink in those gatherings, as that seems to be a risk factor for potential transmission. But again, I think that people can now look at that gathering rule and consider cautiously making plans to visit loved ones. I think that question of whether or not children can visit their grandparents is really an individual family decision. So I don't have a prohibition against that, but I would say that those individuals who are older, especially those who are over 80, do have a much higher risk of severe outcomes from disease. So I think each individual family is going to have to weigh out their ability to be able to maintain distance and have visiting against that concern about the potential risk of transmission. And that's something that, again, there's no rules about. It's more of an individual family risk assessment.
All right.